You are one of 5 of the board-certified plastic surgeons here at Plastic Surgery Northwest. Can you start by telling us who you are and what you specialize in?
Mm-hmm. I'm Sousa. I grew up in Alaska, and I spent all my childhood there. Eventually, after high school, I moved to Seattle, and I did undergrad and medical school and residency all at University of Washington. So I was there for quite a while. And then I traveled to Melbourne, Australia to do a fellowship in microvascular surgery, kind of high-level training for the specific type of surgery that I do now. After that, came back and worked in Seattle for a while, and then now have been here in Spokane for almost 7 years at Plastic Surgery Northwest. I am currently doing, my specialty is generally breast reconstruction. So the vast majority of what I do is reconstruction after breast cancer. It's a combination of implant reconstruction as well as the free flap reconstruction, which is using a woman's own tissue to rebuild the breast after breast cancer.
So you said you grew up in Alaska. Mm-hmm. Take us back to the beginning, where you grew up. Was there any influence there that kind of led you towards medicine?
Yeah, so not really, okay? I come from a family where I was the first person in my family to go to college. I don't have anybody in medicine in my entire family, but I kind of always had an interest, and I have no idea where it came from, TV or what, I don't know. But from when I was pretty young, probably like elementary school, I was talking about I wanted to be a doctor. And actually in my office over here, I have a little like 3rd grade handwriting thing that says, when I grow up, I want to be a doctor. And I think it says something like, I want people to respect me. So I just had that in my head. And then going through, junior high and high school, I just sort of sought out little opportunities. Maybe one of the most formative was in high school, I worked with, I shadowed a breast surgeon. It was a woman who was doing all mastectomies and breast cancer work. And I just followed her around like one afternoon a week. And sometimes it was in clinic and sometimes it was in the operating room. I never really did anything, but just watched her. And she became a friend and a mentor. I still keep in touch with her. But I think that was probably my first experience where I was like, yeah, I think this is what I want to do. But it was a little bit from scratch because, like I said, no one in my family had been to college. So the whole even like application process was like brand new for all of us. And then moving through those different stages. So going from college to med school to residency, I really kind of had to work it out on my own because I didn't have like a real close role model or family to get through that. And there's surprises along the way, right? Like I remember there's a process at the end of medical school. It's called the match, and it's where you figure out what your specialty is going to be and where you're going to go and get that residency training. It's not totally random, but it feels like a random selection. And I remember halfway through medical school being like, wait, at the end of this, I don't get to choose? And like mind blown. And then I felt just silly in a way because I was like, how did I not know this? But I think it comes from that like, background, you're just working your way through it. So I don't know where the idea really came from, but I had it from the beginning. And then for plastic surgery in particular, I had a really roundabout path to get there. So somehow as a younger person, I was really interested in surgery and thought that's what I wanted to do. You don't know anything about what that job means. I think some of it is both of my parents are like incredibly hardworking, dedicated people, and they do work with their hands. And that was sort of like pounded into us as we grew up. Like, you can fix these things, you can do the work. It never occurred to me that I would have like a desk job, right? Like sitting behind a computer, or I was going to have a physical job, a standing up job, a job using your hands. And so I think surgery kind of really leaned well into that. I talked about being a neurosurgeon. I talked about being an orthopedic surgeon. And it wasn't until the very end of medical school. So I had kind of narrowed in on doing OBGYN. And I think a lot of that was my interest in women's health. There's some surgery in there, there's some medicine in there. I was really interested in, it's called GYN oncology, but taking care of, like ovarian cancer and uterine cancer, those types of things. And then one day I just had this like moment where I was like, but wait a minute, I'm not interested in babies. I don't like, it's all about surgery. I'm not really interested in the whole other half of that, which is delivering babies. And so I started to look around and I totally stumbled on plastic surgery. I thought, my preconceived notion of plastic surgery was it's all cosmetic surgery, facelifts, breast augmentation. And at University of Washington, they have the entire spectrum of plastic surgery, taking care of kids with cleft lip and palate, taking care of breast cancer, taking care of trauma, that whole spectrum. It was another like, where have I been my whole life? Where's this been my whole life? Moment where I was like, this is for me, right? It's just such a broad specialty. You're fixing all types of problems that other people can't fix. And I just fell in love with it. And so that was kind of the start of my route into plastic surgery.
Were there specific moments during medical school or your residency that shaped the surgeon you've become today?
Yeah, I think in residency, you start learning everything, right? You start really general. And when I went through residency training, how the program was set up at the time, I actually did 3 years of general surgery. So like doing like appendix surgery and gallbladder surgery, not plastic surgery at all. I did that for the first 3 years. The last 3 years of my training were all plastic surgery. That first 3 years was really interesting because sometimes when you're in it and like, okay, I'm going to be a plastic surgeon, it seems like, why am I wasting my time learning all this other stuff? But what it really did for me is it made me able to speak the language of all of the other specialties. And that's really, I think one of my strengths now is I work with breast surgeons, I work with general surgeons, I work with orthopedic surgeons, neurosurgeons, pediatric surgeons, urologists, like all of these different specialties need plastic surgeons to help them do whatever they're trying to do. And that first 3 years of really broad training allowed me to speak their language, right? And understand some of the things that they are thinking about, ask the right questions. And I think that in Spokane, in the medical community here, it gives us a lot of street cred, right? If you're able to like talk with these other surgeons in a way that they're like, oh, like she knows what's going on with this patient. That's one. And then I think probably the other thing that comes to mind about experiences during residency that really shaped me, when you get closer towards the end years, you have to choose what is your subspecialty going to be. Like, what are you going to want to focus on in your career? I loved it all, right? So it was hard for me to choose. But I think what really captured me is microsurgery. And there's like some magic that happens with microsurgery. Okay, so in the simplest terms, what we do is we're transplanting tissue. So you're disconnecting tissue from one part of the body and reconnecting it to another part of the body. So sewing little blood vessels, reconnecting the skin and the tissue. And there's a moment when the tissue is effectively dead, right? Because it's disconnected from the body, has no blood flow. We do all the work, and this is really technical stuff under a microscope to reconnect these blood vessels. And then there's a moment when we open the blood vessels and it comes alive again. Like it starts turning pink. It has little blood that comes from the edges and it's alive again. And there's a moment that I still have, like this moment of wonder where you're like, it worked. Like it actually worked. And now I've done thousands of these. So like, I know it's going to work, but it's just like that magic isn't lost on me still. I still think that's really fun and exciting. And I think seeing that in residency was like, okay, this is what I love doing.
Why was plastic surgery, you kind of spoke to this, but is there one particular thing that was just like, this is why I'm doing plastic surgery?
Yeah, I think people ask that question a lot. And like, I really think what it boils down to me is, as a plastic surgeon, especially in the reconstructive work that I do, you're solving everybody's problems. Okay, so you're making surgeries and treatments possible that wouldn't be possible otherwise. Okay, so they crashed their motorcycle and they've broken all the bones in their leg and have lost a lot of the skin and soft tissue on their leg. I mean, years ago, they would have had an amputation, no question. But now we're able to replace the skin, fix the bones, give them a functional leg. It can't happen without plastic surgery. So the orthopedic surgeon could fix the bones, but if there's no skin over the top of it, they have to have an amputation. So, and that example carries through in all types of different surgery, pediatric surgery and some of the general surgery, neurosurgery, things like that. So I love that. I love sort of being like a problem solver and making things possible that otherwise wouldn't have been possible. The other thing I love is just the variety. So many surgical specialties, they own a particular body part or a particular system, right? Like orthopedic surgeons are the bones, urologists are, kidneys, bladder. We are head to toe, men, women, children, newborns to end of life. We deal with trauma, congenital differences, cosmetic surgery, cancer. We literally do everything. So every day it's something different. There's no two patients that are ever the same. And I love that sort of like creative, out of the box thinking that this requires every day.
Yeah, that's awesome. Can you think of one patient in particular that just was the most impactful to you?
Honestly, here is one of the patients that really is impactful to me is there are, I'm sure but there are genetic differences. So patients have genetic mutations that make them more or less prone to different diseases. And we're learning a lot recently about genetic predisposition for cancers. Okay, so maybe you've heard of BRCA1 and 2 genetic mutations. Some of the patients that impact me the most are the women that learn that they have these genetic mutations, know they have a risk of breast cancer, and choose to do something about it. Okay, so it's an enormous amount of courage that these women have. There's nothing wrong with them. In the moment, they don't have cancer, but they're choosing to jump into a really big deal, having a mastectomy, losing their breast, going through the reconstructive pathway. And some of these women are young, in their 20s, in their 30s. They always really impact me with their courage and their like willpower to do something and sort of change the direction of their future. I've taken care of lots of these women at this point, and every single one of them, I just am struck by how strong they are in making that decision. I have lots of other stories about, crazy wounds and, body parts falling out and, all types of crazy things like that. But I think in those situations, there is an element of like, well, we have this giant problem. We have to do something. And so those women I was talking about are really interesting to me and impactful to me because like they don't really have to, but they're choosing to. So I love those.
When you think about being a successful surgeon here at PSNW, what does that mean to you?
So first and foremost, absolutely, it is all about the patients. Okay, so it is taking care of the patients to the best of our ability and to the level of their needs. Okay, so we are an incredible practice. So I have 4 partners. We provide care at a level that is unmatched. Okay. We often think of like academic universities being the place where people get the highest level of care. We are performing at that level. And if not, in my opinion, even higher because we have the ability to include some of the more aesthetic components to this reconstruction. So number one, what makes you successful as a surgeon here at Plastic Surgery Northwest is taking absolute exceptional care of your patients. There's a lot of things that go into that, right? It's planning before surgery. It's executing a technically difficult surgery and in a perfect way. It is talking to your patient, understanding their goals, right? And making sure that the plan that you have matches what the patient's hope is or, what is required for this certain situation. It's the post-op care, right? It's following this patient. In many of our patients, we follow for a couple years after their surgery. So following them and making adjustments as you need going forward. So that's the patient care piece. We are not just 5 surgeons. We're a giant team. We have 70 employees here at Plastic Surgery Northwest. And so as a surgeon and an owner of that business, I feel a huge responsibility to make sure that the people that we have are the same quality as the surgeons and that they are supporting that mission. And then third, again, 70 employees, I feel a huge responsibility to take care of those employees, right? And make sure that they feel like they are contributing to something that's important and is having an impact on our community and create a work environment where they can do the things that matter and make them happy in their jobs. So I think those things are all required to be successful here. And gosh, the list goes on, right? When you run a business with partners, right? There's a lot of like relational things that are like super critical. I trust all 4 of my partners to the end of the earth, right? We often talk that it's a little bit like a marriage, right? We are in this thing together and we are dedicated to working through it. And I think we've shown that we do, and we have a really excellent product at the end of it. So there's a lot that goes into it.
So you spoke to the patient experience and how important that is. Part of that, I think, is keeping up on your craft, as they say. How do you stay up on research, the latest in plastic surgery?
Yeah, there is a ton to read, right? And so there are many different resources that I'm constantly skimming and going through, just making sure that I'm hearing new updates, both from like a research perspective, clinical perspective, business management, what are trends in plastic surgery. There's a lot of that. There's publications that come through the American Society of Plastic Surgeons. Another way on sort of like more local level is involvement in regional societies. So there's the Washington State Society of Plastic Surgeons and then the Northwest Society of Plastic Surgeons. And I've been involved in both of those. I was a previous president of the Washington State Society, and just a couple months ago was at the annual meeting for the Northwest Society. So I think that's a really important way, is sort of not just keeping up on like what are the textbook things that are going on in our specialty, but like what are the political or legislative things that might be impacting us? What are peers in other practices around Washington State or the Northwest? What are they encountering? What are they seeing? And how can we all support each other in this little niche subspecialty that we have? So those are probably the main things, reading, making sure I'm seeing the stuff that's coming out of the like research institutions, and then also just kind of keeping in touch with the local and regional societies.
So you're not just a surgeon here, you're also an owner at Plastic Surgery Northwest. Tell us a little bit about that leadership role for you.
Okay, yeah. I have been with Plastic Surgery Northwest almost 7 years, and an owner, it's been about 4 years now. It evolves over time. So for the past several years, I have been working as the lead physician. So that's not really that I have any like power over my partners, but I am sort of like the funnel where most things come to. And I am the leader in sort of organizing how the physicians run the practice. And with a practice as big as we are, 5 surgeons, 4 PAs, 70 employees, it's a big job. It's something that I really love because I not just get I'm a surgeon, I have a clinical job, I take care of patients in the office, but there's this whole other really interesting business side to it. And a little bit like I was talking about earlier, making sure that we are creating practice and a business that is sustainable and that will make an impact on our community and hopefully outlast all of us when we finally go on and retire. Those are the things that I am thinking about. We have built out goals for the next, 2 years, 5 years, 10 years. Our goals are big and they're exciting. And I love sort of having a role in pushing that forward.
Yeah. So you spoke just now to the goals that you have. What do you have for this year that you're hoping to kind of work on, push through, make important to the practice?
We have constantly been talking about how to expand our reach. Okay. The Northwest is a little bit of a dead zone for plastic surgery. Okay. And which is good and bad. So the closest centers that offer anything like we do are Seattle, Minneapolis, Salt Lake City. There's nothing else. Okay. And that's great. And that we can sort of dominate this region and take care of all the patients in this region. But it's tough because many patients live in rural areas. They don't have easy access, or they just don't even know what's available, okay? And so we are making a really big effort to reach out to patients that are in, not just northern Idaho, but other parts of Idaho, western Montana, maybe extending into eastern Montana. We get a little bit of northeast Oregon, and just providing education, resources, letting people know that we're here, just expanding that reach a little bit so that really we can serve our community and serve our region and saying like, hey, there's more for you. There's, using breast cancer as an example, there's a lot of patients that get treatment and never have a conversation about reconstruction. It's not that, they don't want it or that their doctor doesn't know. It's just not easily available. And so we are actively working on reaching out to a lot of our surrounding communities, the physicians in those communities, providing education, providing resources, creating programs for how to see patients remotely on telemedicine, how to find providers in their area that can help us with some of the post-op care, how to make their travel here and their stay here when they come for surgery a bit easier. So that's something I'm really excited about and kind of focused on in this next year.
Yeah. So for potential patients listening, how do they reach out to you? How do they find you?
Our practice is Plastic Surgery Northwest, and you can find us in any way you wish. So we have a website on the internet. Our phone number is 509-838-1010. You can find us on social media. You can talk to your friends in the area. There's many, many patients we've touched in this area that have experiences with us. Even if you have questions, you're not sure if this is the right path for you, our staff are amazing at sort of helping you work through what might be the right path for you, whether it is cosmetic or reconstructive. A little bit like I talked about earlier, we have an incredible breadth of skills and things that we offer. And so we probably can help.
Amazing. Thank you so much.
Yeah. Okay, great.